Aloha Medical Mission is a nonprofit corporation. It was started by volunteers, and it began about 30 years ago with really a Philippine plastic surgeon back in the 1980s who, with his anesthesiologist's wife, decided to go back to his hometown and do plastic surgery on children, restorative surgery on their lips and burns for free. So when I joined in 1988, and it's been growing since. Volunteers have brought other interests to the organization, and we expanded to other countries like Micronesia, Vanuatu, Bangladesh, Laos, Burma, Nepal, Vietnam. And most recently, this past year, we've added 2 missions, one to Honduras and Cambodia. So who's behind Aloha Medical Mission? I think the key element of Aloha Medical Mission are the volunteers. We have a paid staff that runs the administrative duties, and we have a paid dentist, but by far 95% of what AMM does is because people volunteered their time. They wanted to join, they wanted to do a mission. Certain volunteers decided we wanted to have a medical clinic, we wanted to have a dental clinic, and they took this initiative and purely on their own time, with their own dollar, put this together and created a dental clinic. It was not brought on by somebody else telling us that we should do this. It was people within the organization who said, it's time we do this. It's time we go to this country or this town. It's time that we start this project. And without any incentive to be reimbursed or thanked or to have any reward to it, these volunteers on their own produce these projects. And I think that's the miracle of Aloha Medical Mission, that it's always been, and I hope always will be, an organization run by the initiative and the passion of the volunteers that have created it. Why did I become involved, and why do others become involved? I think it's a universal impulse to want to give back to your community. It turns out that when we go abroad, it's a world community, but we have projects here locally, so it's also giving back to the local community. So the volunteers I know give their time, we give our money, a lot of resources to doing it, because I think we feel we have to give back to our communities. The number of volunteers that we need on a mission really varies as to the type of mission. Typically a surgical mission with 4 to 6 operating room tables would require 25 to 35 volunteers. So in addition to the medical people that come, we need, and we always bring non-medical people along to help us conduct the mission. Teachers, accountants, attorneys, counselors, all kinds of non-professional medical lay people. I mean, there are challenges at many different levels. At the simplest level is what kind of food to eat. Are you going to get sick if you eat the wrong food? Is the hospital bed hard or soft? Are there bed bugs? You know, are you going to get mosquito bitten? Are you going to get dengue fever or malaria? So there are issues of health and transportation. Does the bus come on time? And their bigger issues are your supply box is going to get confiscated by the customs. And that happened in a couple missions where the supplies were delayed for 2 days and delayed our mission. And recently some boxes were held up and drugs and equipment couldn't get to the destination on time. Clearly these people that have heard about our mission are anxious to get seen, because the reason we're there in the first place is that these patients in poor countries have not been able to get medical care, either surgical or medical care, either because they're poor, which is the primary reason, or because the facilities aren't available, meaning they're in a part of the country where they don't have a hospital or a health clinic to go to, or it takes a lot of money to travel to a health clinic, and when they get there they can't afford it anyway. So these patients are oftentimes very desperate. They're certainly anxious to get seen by any type of health professional. I can recall an instance in Nepal where this was the town's first medical mission, and the scene that we saw there in the waiting area was in a small, darkened, unlit waiting room. At least 200 people crowding in with their papers, anxious to be seen, pushing against the organizers, trying to get them in line. Concrete walls, concrete floors, noise. One couldn't even think during this time. And I can tell you that it is an interesting phenomenon, because you don't see this obviously in our local hospitals and our clinics, and it's clearly a different scene. In other countries, patients are very well behaved, stand in line, and it just depends on the culture and the anticipation that surrounds the mission.